Most hockey players with bunions are told that their toes look the way they do because of genetics or narrow shoes. While these can absolutely play a role, if your goal is to change the function of the toe, it won't happen unless you do this one thing properly. So what actually causes bunions? Over time, the foot needs to create gapping and widening as it moves through a walk. This happens when the inner arch of the foot goes down towards the floor, also known as pronation. When pronation works correctly, the middle foot opens and widens, and pressure is distributed across the foot. When the foot can't create an opening in the middle foot, the body needs somewhere to yield the pressure. So instead of gapping the middle portion of the foot creates space on one segment, usually at the big toe joint. What happens next is the foot then just collapses downwards. Pronation becomes uncontrolled and excessive, and push-off shifts too far to the inside of the big toe. Over time, this repeated stress causes the big toe to drift, and a bunion is then formed. And here are great exercises to do for this problem. The first one we're going to do is the middle foot gapping. Cross the leg of the foot you want to work over. Grip the underside of the bottom of the foot with one hand and grip the inside of the heel with the other, pulling the foot towards the knee. One hand down and the other one up. You should then feel a stretch in the middle portion of the foot. And for the second one, we're going to train proper pronation, which all you need is a wedge for this. You're going to place the wedge underneath the first and second toe. Take a step back slightly with the opposite leg. Square up the hips in front of you and lock out the knee. Gently unlock the knee and push it over the big toe. Rotate the pelvis away as you keep the hips level. What you should feel is the arch of your foot wanting to lower naturally. You want to do 10 repetitions of 2 sets for both of these exercises.